and welcome. This is Healthy India and I'm your host Lottie Alaric. Well folks, we are here once again to discuss today about swine flu. Now what is swine flu all about? How does it spread? How do you catch it? And do you have to be careful if there's somebody who's suffering of swine flu in your house? These are some of the things that we are going to try and find out in this program. So do stay tuned for the next 1 hour. So to tell us about swine flu, I have in the studio 3 eminent doctors, and I'm very happy to have with me Dr. M.C. Mishra, Director, AIIMS. I welcome you to the show. Sitting next to him is Dr. Sunil M. Raheja, Medical Superintendent from GV Pant Hospital. Welcome to the show. And I also have with me Professor Dr. Virendra Singh, Department of Pediatrics at Lady Hardinge Medical College. Thank you for being here. Well, Dr. Mishra, let me just begin with you first of all, because all this while we've been discussing about dengue, and once dengue has subsided comes swine flu. Now, what is swine flu really? If I were to ask you to define it in very simple terms, how would you explain?
See, swine flu is a virus caused by virus, influenza-like virus.
Okay.
And actually it is influenza virus which affects pigs, and that's why it is called swine.
Swine.
So it happens in pigs, and then from pigs, those who are working around the swines, it comes to human beings, and then there is a human-to-human transmission. And it affects primarily respiratory system, and particularly the upper respiratory system, and the symptoms are no different than common influenza, which we call जुकाम खांसी हो गया सर्दियों में, and the virus thrives in that temperatures. It is unlike dengue virus, which thrives in temperate climate. It thrives in little colder temperatures. So that's why it is a good idea to discuss this before the winter sets in, because swine flu, if at all, would come into this weather. The other thing, this virus mutates also.
Okay.
That also happens. And another thing is that largely it is transmitted from human to human. So important thing is that if people have self-discipline and themselves self-quarantine if they have symptoms, flu-like symptoms, influenza-like symptoms, then they should quarantine themselves in the households and also keep away their near and dear ones, family members away from them. Avoid traveling, avoid going into crowded places, avoid traveling by plane, train, because they can spread the disease from that. And rest, basically. The symptoms are like that you need to take rest, have good nutrition, good hydration, and remain indoors, isolate yourself in home environment, and most people will recover from it.
All right. So that's an overview that you've given us. Now, Dr. Raheja, if we were to talk about the burden, are there any figures to suggest anything that which part of India do you find that more people could be suffering of swine flu or would in the coming months?
Yeah, basically the patients have been reported from the Rajasthan central part of the Madhya Pradesh, Karnataka. And basically, as Dr. Mishra told, this virus basically tends to affect more during the winter season, from November to March, and particularly the peak comes around January, because during this period, because of winters, the people tend to stay confined, like a closed environment, and this virus basically spreads through the air in a droplet, through the droplets.
Right.
And once people are living in a closed environment because of winters and not maintaining those cough etiquettes, this virus tends to spread very fast. Particularly this affects the old age, more than 65 years, those who have less immunity, children below the age of 5 years, and those who are having chronic illness like chronic obstructive pulmonary disease, cardiac disease, having steroids and immunosuppressant kind of drugs. And particularly, it doesn't mean that it cannot affect the other person, but this group will be a more pregnant woman. So, basically we have to ensure that during these period we have to improve the immunity of the body. And that Dr. Mishra already told that you should have a nutritious, balanced diet and have exercise, have a good sleep and exercise, because all this will improve your immunity. And if anybody has got cough kind of a symptom, because you know this basically we have three categories and the real actual name for this is seasonal influenza H1N1.
H1N1.
Swine flu was because it came from the pigs, but at present I have to clarify here, because this virus basically now spreads from human to human. There is nothing pigs to like that kind of thing. So we have to ensure that the person who has got fever like category 1, the person will have sudden onset of fever with chills, headache, myalgia, cough, cold, running nose, stuffiness. So that is category 1. And category 2 is with high risk, as I told you, with coronary, CAD patients, cardiac patients, pregnant women, small children, elderly patients. And category 3 is one which needs hospitalization, isolation and testing, investigations. And
so before we go to the investigation part, I'd like to bring in Dr. Singh into the discussion. Now, I would want you to tell us a little bit about little babies. You know, first if we begin with infants. Now, are these, as he said, that these could be the most vulnerable group. So how can people, you know, parents, as parents, what are the preventive measures that can be taken?
You see, most of the time what happens is the children get their infection from either, I would not rather start from infant, I would start a little older age group, which is where children are sent to play schools. That's a big herd of people, children, who do not have immunity. And you put them together. And therefore the spread of any disease in this community would be faster. And more so when they are in small rooms which are overcrowded. So all those play schools which people are very fond of, or even formal schools, if they are not properly ventilated, that is where most of this disease spreads in children. Younger children, infants, which you refer to, are more prone to getting a serious illness, either from a sib or from an adult in the family. Because the airways per se of a small child are small, they are more likely to have a disease which will cause more rapid breathing and more complications than in an older child where it may stay up. So that's one major distinction between very young children versus the others. So an important thing which the viewers must remember is that we are in today's time in a lot of a hurry. If you have a sick child at home, you want that child not to miss school. And I would also like to address through you the principals and teachers, if they are watching, that there are many schools which run a special shield for a child who has never missed the school. So to get that shield or award, children who are not too well would also be sent, because they want that 100% attendance. That's not important. They need to look at it in a different view, because what they meant was that children do not absent themselves from school for unnecessary reasons. But now this has taken another swing. And that is what is perpetuating disease not only within the children, but also these children bring it back to the adults at home. It will be interesting to mention here, when the swine flu first came about 5 years back, the most of the spread was through a congregation of the students in a big sporting event. And when it broke out in those hill stations, the outstation schools, the children were sent back to their homes, which were in different states. So instead of containing the disease, we actually spread it without knowing it.
Right. Well, so that's an important point that Dr. Singh really mentioned. So schools, I think this is really important for us to understand that it's really not important for that 100% attendance, but the children should be healthy. That's the point. Okay, now Dr. Mishra, what would be the initial symptoms of swine flu? Because this, what I'm gathering, cough and runny nose and all that, this could go with just about any kind of fever. But when it comes to swine flu, are there any particular symptoms that one can be aware of?
The symptoms, one thing I would, very important what Dr. Singh has just said, I would like to say that this is very common in crutches. Children, we used to started sending my son to one crutch, and every alternate day he'll come with a running nose, and we stopped doing that. So I think that is also very, very important aspect for children to contain. Now, as regards, first of all, I will say why it is called H1 and N1.
Yes.
I think people will say why this fashionable name has been given. So it is basically, this virus has two antigens, surface antigens. One is the hemagglutinin 1, type 1, and another is neuraminidase type 1. So that's why it is H is derived from hemagglutinin and the N derived from neuraminidase. So that's why it is called H1N1. Most humans which are infected from this, and the test is same for both, whether it's a human or swine, H1N1 positive. And if it is positive, it will not differentiate whether it's swine flu or it is usual influenza, common influenza. So it might be positive in both. It is different for B. Now, when you talk of symptomatology, then naturally headache, running nose, sneezing, coughing, and severe coughing can take place because it affects the respiratory system, upper respiratory system first, and then as Dr. Raheja also mentioned, that those who are immunocompromised and very young, elderly, pregnant women, where it could affect much more, and the cough bouts may be much more severe. And many a time those people who are, say, immunosuppressant drugs, transplanted patients, otherwise on chemotherapy, cancer chemotherapy, are more vulnerable for any kind of infection.
That's right,
and
that's
for
right.
even the H1N1 also. And then this respiratory symptoms can actually worsen in some of them. What you said, type 3.
Okay.
This group we have to identify, and people have to identify themselves. If they are getting breathlessness and some kind of, then they should consult the physician immediately. Otherwise, symptoms are very common to any viral ailment, common influenza. So they are no different, that they'll be having headache, sneezing, coughing, fever which is more than 100 degree Fahrenheit. Fever may not be very high like we used to see in dengue in 104, 103, but there will be fever, and body ache, muscle ache, fatigue, listlessness, you don't feel good.
Lethargy.
So that's why I said the taking rest at home, self-discipline, and self-containment, isolation yourself. So somebody need not to have a separate area, and majority of them, they need not to be hospitalized. Only that group, type 3 illness, needs to go to hospital and may require, extreme case may require ventilatory support if it affects the respiratory system. And there is a
I will talk to you about that as well, because whether any complications can arise in patients who are suffering of H1N1. But right now, folks, we need to slip into a break. But when we come back, our lines are going to be open. So if you have any question that's related to H1N1, that is commonly called as swine flu, then this would be your time to ask those questions. But only when you have lowered down the volume of your TV sets so that you are able to hear us and my panelists are able to hear you. Our numbers are on your screen, which are 1800115314 and 23035420. Swine flu, that is H1N1, is what we are talking about today.
उंगली थाम के जिसने चलना सिखाया, कड़ी मेहनत करके हमको पढ़ाया, हमारी खुशियों को अपनी खुशी बनाया, जिंदगी के हर सुख दुख में जो एक साया बनकर साथ रहे, ढलती उम्र में इन्हें अकेला ना छोड़ें। ध्यान रखें, माता पिता एवं वरिष्ठ नागरिक भरण पोषण एवं कल्याण अधिनियम 2007 के तहत माता पिता की देखभाल करना हमारा कर्तव्य है और उनको बेसहारा छोड़ना एक अपराध है। सामाजिक न्याय और अधिकारिता मंत्रालय, भारत सरकार द्वारा जनहित में जारी।
We discuss issues that concern you, affect you, a forum for all viewpoints.
किसी की नजर ना लगे,
बेबी को किसी की नजर नहीं लगेगी।
बुरी नजर से बचाने के लिए इतना कुछ। सबसे पहले से बीमारियों की नजर से तो बचाइए।
वो कैसे?
संपूर्ण टीकाकरण से। ये बच्चे को कई जानलेवा बीमारियों से जिंदगी भर बचाएगा। 2 साल तक के बच्चों का संपूर्ण टीकाकरण जरूर कराएं।
मिशन इंद्रधनुष, जिंदगी इंद्रधनुष बनाए।
घर में गणित नहीं किया ना? अरे ओ बगुला बगुली, क्यों करते हो खेल छुपा छुपी? मच्छी के संग कैसा ये जंग, सवेरे सवेरे ये कैसा रंग, दिखने में हो अति शांत, फैलाते हो क्यों अशांत? कहाँ से उतारा ये? कहाँ से उतारा है?
सर, इसे मैंने खुद लिखा है।
झूठ बोलता है, शर्म नहीं आती? बेशर्म, दिखा 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 दिखा, हाँ दिखा 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 दिखा।
हर खेल, हर खिलाड़ी, हर कोच और हर मैदान हमारी नजर। हर हफ्ते, हर बुधवार शाम 6 बजे खेलो भारत, लोकसभा टेलीविजन पर।
Welcome back. You're watching Healthy India, and today we are talking about H1N1, which is also known as swine flu. So if there's a question that's in your mind, just pick up your phone and reach us at 1800115314 and 23035420. Having said that, we are joined by Mukesh from Jhansi. Mukesh, welcome to the show.
Yes, ma'am. Good evening, ma'am.
Good evening to you. Please go ahead.
एक्चुअली मैम ये पूछना है कि जो स्वाइन फ्लू का जो वैक्सीन है कि मार्केट में तो काफी कॉस्टली है, 800 से 1000 रुपए का इसका रेंज है, तो पूरी फैमिली में सभी को स्वाइन फ्लू की वैक्सीन लगवाना जरूरी है, या जैसे हमारे बच्चे भी स्कूल जाते हैं तो इन सबको वैक्सीन होना जरूरी है क्या?
ओके, थैंक यू फॉर द क्वेश्चन. बच्चों की आपने बात की. यस डॉक्टर सिंह.
अभी जो रिकमेंडेशंस हमारी कंट्री के लिए हैं वो लार्जली ये हैं कि जो हाई रिस्क ग्रुप है, सो इफ़ यू हैव somebody who has diabetes in adult or a kidney disease or a lung disease COPD, उनको लगवाने के लिए कहा गया है. या कोई बच्चे हैं जिनको हार्ट या लंग की कोई क्रॉनिक डिजीज है, उनको आप लगा सकते हैं, या हेल्थ केयर वर्कर्स के लिए. फॉर जनरल पॉपुलेशन देयर इज नो currently no recommendation to give flu vaccine because flu virus is one of the several viruses which can affect. The vaccine has its limited efficacy and it's not all encompassing, and therefore आप ये सोचें कि एक बार ये वैक्सीन लगाने के बाद सारे फ्लू या सारे कोल्ड खत्म हो जाएंगे, वो तो नहीं होने वाला. और ये जो हम महसूस करते हैं, what we are trying to buy is one insurance policy which will cover all, which is not
it doesn't happen. Okay.
Which is not possible.
But this vaccine is a trivalent vaccine, so it will cover the human influenza, common type, also the swine flu, and also maybe the bird flu. And if the cost is not putting you back, then you might think to get the vaccination. It does.
Basically, you know, this vaccine, as Dr. Singh told, it will give protection to the tune of 70 to 80%. There is no 100% protection.
No 100% protection.
So this virus is already there. So only thing is, as on today, Ministry of Health, Government of India recommends vaccination for only healthcare workers. Those who are dealing with swine flu cases in the emergency, in the ICU, or in the or in close contact of these patients, because this virus is already since 2009 this virus has been in India.
Even care.
So even vaccination is not going to be 100%.
That's right.
Only thing is
let's see what the next viewer has to say. We have Harish Gupta with us from UP. So Mr. Harish, welcome to the show.
Good evening, ma'am.
Good evening. Please go ahead.
Ma'am, my question is to Dr. MC Mishra.
Yes.
My question is that when we count the statistics of the patients of the swine flu, only those patients are counted, as far as I know, whose report is confirmed at the government lab. So in this what we see is that the officially confirmed number of patients count quite less behind than that of other similar countries.
Okay. Well, I guess that goes for almost any condition in India. But yes, Dr.
That's
Mishra.
right. What he is asking, the number of
reported cases and all that.
That Harish ji, that would always be there because the reporting is only done of confirmed cases. And even in dengue, this was the case. If the case is not confirmed, that is not notified. So the reporting is done only on confirmed cases, and that's why the number of people affected would be much larger. And even the recommendation of CDC, even WHO recommendation is that we do not test everybody in the community who has symptoms like flu or swine flu or common influenza. Unless the patients are hospitalized, then we do that testing and we come to know whether this is H1N1 or it is something else.
Something else, right.
So he is right that way.
Right. So Dr. Raheja, are there any red flag signs that one should be aware of?
Yes, definitely. I mean, I will say if the person is having all the symptoms of seasonal influenza H1N1, like headache, fever, chills, and cough, cold, and nausea, vomiting, these symptoms are there. But beside this, if the person feels breathless, there is a blood in the sputum, once coughing out there is a blood, there is blue coloration of the nails.
Okay.
You know, all these signs are red flag signs. And there is a persistent high grade fever, the person is feeling drowsy, and particularly for children, if the child gets drowsy, stops feeding. I mean, it's normally the child, I will say the healthy child is one which cries, shouts, laughs and eats well. But if the child gets drowsy, is not feeding well, is getting convulsions, there is a very high grade fever, all these are category C patients, and these patients must be hospitalized. This is very important here. And because these are the only patient which needs hospitalization, and as per the diagnosis and the physicians or the pediatrician's advice, they will proceed further with testing and further investigations, and depending on merit the patients are treated. Because the important thing here to understand is the patient with high risk group, and these, you know, in this influenza, swine flu, the important thing is that the drug oseltamivir should be started in the first 2 days to get its maximum
Dr.
benefits.
Raheja, I'll have to come back
so that
to you.
That is the important catch.
We have a viewer. This is Mr. J.N. Rao from Tamil Nadu. So, Mr. Rao, welcome to the show.
Thank you. My question is, what are the chances of swine flu becoming fatal as compared to dengue fever?
What are the?
Fatality. Is asking what are the chances of swine flu becoming fatal. Actually, if you look at mortality rates for influenza, it is 0.1%. And in Mexico there was 6% reported, but that was confirmed cases versus deaths. To 2,500 cases, out of that 160 died. But the swine, people affected by swine flu might be much larger. So actually, Mr. Rao, the mortality rates are actually very low, even following swine flu, and most patients would recover without any consequences of this disease within 10 days. And we say that you take rest at home for 2 weeks or so if you have a severe bout of this disease. And as the symptoms which Dr. Raheja said, if somebody has respiratory problem, tachypnea, like fast respiratory rate, or breathlessness, or getting cyanosed, blueness or listless. Mainly, see, it's a very important aspect which Dr. Raheja has brought out, that if I feel like eating, if I feel like watching television, then you know that I am not very sick. And if somebody is sick, he would not like to talk, he would not like to eat. So these are the symptoms where somebody needs to be taken to the hospital.
Right. Okay. Now, Dr. Singh, in case now if you have to investigate a person whether he or she is suffering of H1N1 or not, how are you going to diagnose it? What are the tests that you would be running on this patient?
You see, there is only one test. You do a nasopharyngeal swab.
How would you do that?
I mean, that's you have a swab stick, which is a cotton roll on a stick, which you introduce through the nose, and you take, or you can go even through the mouth, but prefer is that, and you tickle the posterior part of the pharynx. You get the secretions from there, and they are again to be transferred in a proper media, and then it's what we call as a real-time PCR technique.
Okay.
There was a question a little while ago which was asked, that as if the gentleman who asked the question was hinting as if there is a reason for the government to show less numbers. That's not the intent. The reason why the confirmed cases, why only tests from certain accredited labs are taken are because there are many other tests available which are not approved. Their sensitivity and specificity is not good, and therefore those run-of-the-mill tests which are available in several labs are not good. Even if they say you have H1N1 influenza, you may not have it, or you may have it and they may miss it. So the reason why government insists on accredited lab result is only because that's the only situation where you are sure of the diagnosis. Otherwise, there is no way to know. There is no clinical parameter which says all these symptoms which have been discussed are equally well possible with several other viruses which are in circulation in winters.
Right.
So through you, I would like to inform the viewers that just the presence of these symptoms does not make it H1N1 or flu. What are we talking is any person who has a multiple or single organ dysfunction. That means we are talking about respiratory dysfunction by rapid breathing, blueness or listlessness, all those issues, or coughing of blood. Whether it happens with H1N1 or A, B or C reason, they must seek help because there is an intervention which is needed. In this season, this could be one of the reasons. So that is one clarity which needs to come. You can't decide, okay, I have cough and cold, let me get an H1N1 test. You may be suffering from something else which could be equally serious.
Absolutely. Well, we have another viewer. This is Komal from Bihar. So Komal, very quickly, what's your question?
Yes, since I'm watching DDLOKSABHA, so it was coming on the screen, so I think that to call and ask questions to you, ma'am.
Well, I'm afraid I'm not able to hear you.
Oh, okay, ma'am.
Initial symptoms, is that what you said?
Yes, my question is, what are the initial symptoms?
Okay, okay. Komal, you will have to wait for a while because we have to slip into another break right now. But when we come back, we'll be taking your question first. And for the others, keep trying. And the lines are still open. The numbers are 1800115314 and 23035420. Swine flu, that is H1N1. That is what we are talking about today.
किताबें बहुत कुछ बोलती हैं, लेखनी चलती है और रच जाता है एक नया संसार। किताबों की खामोशी को आओ पहचानें, उसकी दुनिया को समझें और जानें। साहित्य संसार में हर रविवार शाम 7:30 बजे।
हर खेल, हर खिलाड़ी, हर कोच और हर मैदान हमारी नजर। हर हफ्ते, हर बुधवार शाम 6 बजे खेलो भारत, लोकसभा टेलीविजन पर।
ओम परमात्मने नमः।
एक बिंदु जिसमें समाया है ब्रह्मांड, अणु से अनंत तक अस्तित्व खोजता इंसान, तनाव मुक्त मस्तिष्क, रोग मुक्त शरीर, शांत चित्त, स्वस्थ और सुखी जीवन संभव है। ये सब कैसे जानने के लिए देखिए योग निरोग हर रविवार सुबह 8 बजे लोकसभा टीवी पर।
भारत को एकता के सूत्र में बांधने वाले लौह पुरुष जिन्हें गांधी जी ने कहा सरदार।
सरदार साहब ने हमें एक भारत दिया, श्रेष्ठ भारत बनाना हमारी जिम्मेवारी है। एक भारत श्रेष्ठ भारत, इस सपने को पूरा करने के लिए भारत की जो महान विरासत है, वो विरासत विविधता में एकता की है।
मुझे विश्वास है हमारी जगह सारी दुनिया में बहुत ऊंची होगी।
सरदार वल्लभ भाई पटेल को शत शत नमन।
Welcome back. This is Healthy India, and today we are talking about swine flu. Well, folks, you can call us. Our lines are open. The numbers are 1800115314 and 23035420. And now we have with us Manish. So, Manish, welcome to the show. Manish, are you there with me? All right. Dr. Mishra, I would like you to take the question that we had an earlier viewer. She was Komal from Bihar and she wanted to know about the initial symptoms of swine flu, even though we've discussed it, but very quickly.
Again, we'll repeat that
yes.
The symptoms may begin with some headache, maybe some sneezing, नाक का बहना, खांसी, और उसके साथ में आपको fatigue होगा, you may not feel well, fever होगा 100 से ऊपर, or you may not feel like even eating, and you will feel unwell, generally unwell, muscle ache हो सकते हैं, body ache हो सकते हैं, headache हो सकता है, sneezing हो सकती है. So these are the symptoms which are akin to any other viral illness or influenza-like symptoms, flu-like symptoms, what we say.
Right.
And only thing I would say, if such symptoms are there in family or in neighborhood, try and use our age-old custom of namaste or salam from distance. Maintain 6 feet distance, because generally these droplets can carry the virus up to 6 feet. And isolate, quarantine, self-quarantine is the best way that people can be disciplined, self-disciplined. Don't go out, don't mix up with people, and even with the near and dear ones. And young couples, husband and wife, avoid love making during that time. And it should carry on for 10 days, even more than that, because the virus can still be there. Even if your symptoms have receded, the virus can still persist. So, as and when, as we have, again we will repeat, as and when there is rapid respiration, सांस जल्दी जल्दी आ रहा है, फूल रहा है, आप बात नहीं कर पा रहे हैं, कहीं थोड़ा सा ब्लूपन तो बहुत लेट साइन होता है, उसके लिए इंतज़ार नहीं करना है कि नेल ब्लू हो जाए, टंग ब्लू हो जाए, और बिल्कुल आप में ताकत ही नहीं है, तो फिर हॉस्पिटल ज़रूर ले जाएं.
Right. Well, we have a view from Maharashtra. This is Mr. Pandurang Patil. So, Mr. Patil, welcome to the show.
Yes, good evening to all of you.
Yeah, good evening. Please go ahead with your question.
Ma'am, I am a person who has a common allergy of the common flu. So I want to know more about what is the preventive, how can I identify the swine flu and the common flu?
From a common flu allergy.
Basically,
yes, Dr. Raheja.
You know, allergy is something like a loaded gun. If you are allergic to something, moment you come in contact with that particular antigen or substance, you can say, you will get the allergy. So I would like to say the best thing is to prevent contact with that. If you know you are having allergy because of dust, try to avoid exposure to dust. As far as swine flu, he said how much chances are there. I will tell you, swine flu is a viral disease and it spreads through the droplets, as Dr. Mishra said. So if you are eating well, sleeping well, doing good exercise, and you are in the younger age group, your chances of getting swine flu is very less, because every day you may be exposed, but your body immunity will take over. So I would like to also convey here that swine flu basically, since it spreads to the droplets and coughing, so we should have cough etiquettes. Whenever the person gets fever, headache, myalgia, this kind of infection, that person, as Dr. Mishra said, should stay home. Rather than going to crowded places, going to office. If the child gets all the symptoms which are suggestive of influenza-like illness, flu-like illness, the parent should ensure that child stays at home and contact a doctor. Because if this child goes to school, it will spread to other children also. So second thing is, while coughing, we should ensure that we don't spit here and there.
Right.
We should use a tissue paper, we should be disposed of carefully in a dustbin with a lid. It's not that you just clean your nose and just throw it on the roadside or haywire, because even that will spread the virus.
Right.
Second thing, Dr. Mishra said, shaking hand, close contact, hugging should be prevented. Rather that formula of Indian, Namaskar is better, stay at least 1 meter away or a shake hand distance away, and keep washing your hands, because once you come in contact with this virus, you tend to touch your nose or eyes, wherever, or your mouth, the virus can spread. Fourth,
so basic hygiene, if that is maintained,
avoid using common cell phone, computers, and all these precautions you have to take during this period. And eat well, sleep well, maintain good hygiene. That is the key to prevent it. That I will say.
Right. Well, we have
and
a
avoid
viewer
smoking
now.
also.
Let me just
because
take this
smokers
viewer.
also get it
Yes,
more.
I'm sure.
And if you have this infection, do not smoke.
We have with us Vikas Sharma from Jammu and Kashmir. So, Vikas, can you hear me?
या मैम गुड इवनिंग मैम.
गुड इवनिंग टू यू.
हाँ मैम, मैं जानना चाहता हूँ क्योंकि H1N1 के केसेस में मोस्ट ऑफ द टाइम 7 to 8 डेज में डेथ हो जाती है, जबकि हमारी रूरल स्टेट्स ऐसे हैं, बहुत सारे स्टेट्स हैं जहाँ पे लैब्स अवेलेबल नहीं हैं. तो उसमें क्या कौन सी टेक्निक्स हैं जिससे हमें इस चीज का, क्योंकि लास्ट टाइम भी कुछ ऐसी डेथ्स हो गई थी कि मरीज हॉस्पिटल में पहुंचा था कि जनाब अब तो काफी सीवियर केस हो चुका है तो अब ठीक नहीं हो पाएगा. तो इस केसेस में क्या कौन सी वेल क्वालिफाइड लैब्स जरूरी हैं कि ऐसी भी किसी लैब्स में डिस्ट्रिक्ट लेवल पे इसकी डिटेक्शन हो सकती है?
थैंक यू फॉर द क्वेश्चन. डॉक्टर वीरेंद्र, आई वुड वांट यू टू टेक दिस.
देखिए, दो बातें हैं आपके सवाल में. एक सवाल है कि टेस्टिंग फैसिलिटी कितनी पेरिफेरी तक अवेलेबल है. पब्लिक और प्राइवेट सेक्टर दोनों में बहुत सारी लैब्स हैं और धीरे धीरे इनकी तादाद भी बढ़ती जा रही है. देयर इज ए डिजीज सर्वेलेंस प्रोग्राम इन द कंट्री जिसके अंडर काफ़ी डिस्ट्रिक्ट्स में भी ये कैपेसिटी बिल्ड हुई है. खासकर आपके क्षेत्र में कौन सी है शायद ये तो मैं नहीं बता पाऊंगा, पर ये धीरे धीरे बढ़ती जा रही हैं. एंड प्राइवेट सेक्टर में भी एक्रेडिटेड लैब्स हैं जो प्रॉपर टेस्ट जो है उसको करती हैं. सारी लैब्स ज़रूरी नहीं है कि इम्प्रॉपर टेस्ट या अनवैलिडेटेड टेस्ट यूज़ करती हैं. तो देयर आर ऑप्शंस विच आर अवेलेबल. मुद्दा ये नहीं है. मुद्दा ये कि द फैक्ट यू सेड दैट एनीबडी हु गेट्स स्वाइन फ्लू डाइज इन 7 days इज नॉट करेक्ट. Most people who get flu, forget the name swine flu or H1N1, most people who get flu do not die. Most people who get flu do not need to be admitted. They will get well. It's a very small proportion, 0.1%, which are fatal. So we are talking about something like 1 to 2% who need admission and about 10% of them or less than them dying. Even 10% is a huge figure if we talk of intensive care. Maybe if we are talking of admission prior to that, where possibly the distinction is also not so clear, the mortality will go down further. So therefore, this fear which is there that everybody should be tested and within 7 days if you do not do anything, something bad is going to happen is unfounded. Yes, early treatment helps. You need oseltamivir very early. But oseltamivir is no wonder drug that you take and it is a 100% guarantee. It's also a drug with a very limited effect. So therefore, do not live under a fear. Look at the probabilities. I can look at whether this glass is full or empty. I want it brim full, then it is empty. But if I am happy that my chances of staying healthy are this high, I should be comfortable. The only thing this program is doing, or all of us are trying to do, is tell you when not to be comfortable. Because common cold is so common that sometimes we leave common sense. So if somebody has a common cold and it goes on to listlessness, it goes on to rapid breathing, it goes on to coughing blood, then don't say कि ये तो हो जाता है जी, थोड़ा ज़्यादा समय लगता है. That is the child or a patient where you will get into trouble. But if all of us start running after a cough and cold to whatever big hospital and want to get tested, will that prevent this death? That's a big question mark. Perhaps it would not. So it's only symptom related. Be cautious about what and where and when you need treatment, and that's the most important information.
Right.
One important thing which all of us have highlighted is it's the hygiene which is most important. We have talked a lot about cough hygiene, covering our face. Equally important is washing our hands, because nasal secretions spread this virus much more. They are much more dense. So you wipe your nose, you put it on a door handle, you put it on a common computer or anything, and everybody else uses it. That's how it spreads. So people who are sick, if they stay away and they wash their hands frequently, and in this season, if you wash your hands frequently, you would also be very safe. When we sneeze, if you want to cover your face, you can use your crotch of your hand.
I think this is what I was
At least your hands would not be stained. You may not have, and carry a hand sanitizer with you. It's so very easy. There are small things which can prevent, and that will go a long way rather than creating more labs and getting into this fear that I have cough, now I need to get tested.
Yeah, second important point Dr. Singh told here, washing of hand is another thing you should understand how to clean your hands. So there is a technique. It takes just 15 seconds.
Yes.
So you put a drop of soap here in the palm, rub it like this. Okay, then you go digital inside the fingers. Then you have to really clean all your fingertips. Then go this way. Clean your nose.
So there's a technique of washing hands properly.
It takes just 15 to 20 seconds.
That is right.
It's not just to just do like this, because the virus will tend to stain your nails and fingertips, and it can again spread. So
I think
you have to just take simple precautions.
That's right. That's a good point that you made. Okay, now Dr. Mishra, tell me, what are the complications that could arise in a person who is diagnosed with H1N1?
As we discussed before, and before that I would again emphasize for the sake, छींक आती है, ऐसे करिए बस, तो वो आपके कपड़ों में चला जाएगा, किसी और को नहीं जाएगा. ये very important precaution which each person who is affected with flu-like symptoms can take for everyone around. Now the complications, as I said, this in the beginning we discussed that this virus predominantly affects the respiratory system, and that gets affected. So generally it is upper respiratory tract which gets affected, and when rapid breathing, cyanosis or blood in the cuff is there, then maybe chances of secondary infection comes in. So it may not be flu virus which now giving rise to problem. It is actually the secondary bacterial infection which is giving rise to these problem. And actually when we require respiratory support or ventilatory support, it is the secondary infection which is far more important and takes the toll than H1N1 itself. So that is, we have to understand that. But naturally, once one system gets affected, then other systems, particularly depending on the age of the patient, here a lot of variables will come into play. That if somebody is elderly, naturally the prognosis is much worse than if somebody is young, can fight out the disease.
That's right.
If somebody is very young, again the prognosis is bad. So I think that is what we have to keep in mind, and that is where the supportive treatment also helps in recovery of the patients. So patients do recover from ICU and they go home.
Right. Okay, now Dr. Raheja, tell me, you all were talking about pregnant women, you know, this also could be a very vulnerable set of people. So what are the precautions that must be taken for the pregnant women?
Basically, pregnant women during pregnancy, what happens is the immunity is low. This is one thing. To improve that, the woman should take a balanced, nutritious diet, which is good in vegetables and fruits, particularly fruits, citrus fruits with vitamin C. They are good. Fresh vegetables, they are good. Balanced diet is important. Good sleep. Again, I would like to say that the sleep is basically gives rest to the body, improves your immunity. And if you are not sleeping, it's a state of stress for the body. Body takes it as a stress. So you have to understand basics, that you have to sleep well, keep smiling, take lot of liquid, plenty of water, balanced diet, and these women should also stay away from the crowded places during this season. And if somebody you see is having cough, fever, try to come in, avoid a close contact with that particular person.
Well, I'll have to again interrupt you because now it's time for us to slip into yet another break. So people do come back quickly. If you still have a question on your mind, then just keep your questions ready. And the numbers again, I'll repeat them for you: 1800115314 and 23035420. Swine flu, that is H1N1, is what we are talking about today.
घर में गणित नहीं किया ना? अरे ओ बगुला बगुली, क्यों करते हो खेल छुपा छुपी? मच्छी के संग कैसा ये जंग, सवेरे सवेरे ये कैसा रंग, दिखने में हो अति शांत, फैलाते हो क्यों अशांत? कहां से उतारा ये? कहां से उतारा है?
सर, इसे मैंने खुद लिखा है।
झूठ बोलता है, शर्म नहीं आती? बेशर्म, दिखा 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 हाथ दिखा 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 हाथ दिखा दिखा दिखा।
Welcome back. This is Healthy India, and today we are talking about swine flu. Well, so we've spoken enough about the disease. Now I think it's time for us to talk about the treatment part of it. So, Dr. Singh, you can start. What is the first step towards treatment?
You see, there are two parts of the treatment. One is what we call as supportive therapy,
right,
which is very important, that if you take care of the patient's fever, you take care, give them adequate rest, because it's a viral illness, it's self-limiting in most situations. So, hydration, feeding of a small child, and taking care of their temperature is the first primary thing. You may have a convulsion in a small child because they suddenly the temperature shot up, and not necessarily because this child was having a serious H1N1 infection. So there can be several facets or several appearances of the symptoms due to different things. So supportive therapy, in which hydration and feeding of the child or an adult is very important, is the first important thing. That is the supportive part. Reminding yourself about preventing and not spreading the disease to others is the second part of that. The third important thing within this supportive therapy also is to be, because when we say supportive therapy, you are asking these families who have children or adults who have mild disease to stay at home. So they must also be equipped with this knowledge when to seek help. So we time and again talked of many symptoms which are suggestive of a serious illness or a pre-existing condition which may make you more prone to a serious disease. So of which we talked of pregnant situations, we talked of chronic illnesses, particularly of the lungs, COPD, asthma, but also the transplant patients or chronic liver disease or a chronic kidney disease or a severe uncontrolled diabetes, things like that. In a young child, it may be a premature child or a child who was previously ventilated or a child who has a congenital heart disease. They would also be the high-risk groups. So if you have any of these high-risk groups, possibly you would need a preventive therapy, or you would need not a preventive because you already have you would need therapy. So that's what we call as a severe category P, where you are taking a preemptive step. But these patients only need antivirus drugs in addition to supportive therapy, oseltamivir, which is now available across in the government as well as in the private sector. So there is no limitation that you have to visit a government facility to get it. It is also available in the open market. It's a restricted drug, but it's available. The other thing is that you have a serious illness, and we talked about, particularly it starts with rapid breathing, and Dr. Mishra and Dr. Raheja, both of them very clearly said, don't wait till your nails are blue. You have to seek help before that. So anybody who has serious illness which comes with rapid breathing, blood-tinged sputum or listlessness, a great deal of lethargy, where even when the fever has gone away, the child is not playing or you are not up to your mark, that's a sickness. Otherwise, once the fever is taken care of, you do not feel sick, you are okay. So those kind of small subtle signs will tell you that you may have a serious illness, and that's where you seek help, and you may be benefited by this drug called oseltamivir.
Right. So Dr. Raheja, how many days does it take for the person to be on his or her feet and get going about one's life?
Basically, as we have been discussing, you have to take rest for 1 week. Moment you have symptoms like flu, swine flu, you should stay at home, take rest, take nutritious diet, plenty of liquid. For fever, the safest drug is paracetamol, which is 10 milligram per kilogram body weight. Adults 500 milligram tablet 4 to 6 hourly for fever. Children, there are syrups, and fever will subside. I will say more than 99% patient, if they take good diet, nutrition, rest, they will recover. And as far as antibiotics are concerned, only to be taken in consultation with doctor if there is any secondary infection.
That's right.
As Dr. Singh told, if there are any serious signs, you must go to hospital and get admitted. Otherwise, I think taking a symptomatic treatment with your neighborhood doctor who is a physician or a pediatrician
should be enough.
Is a good idea.
That's right.
And if you all rush to the hospital, because we have been discussing, it spreads through air. So your chances of getting infection otherwise or spreading
more
the
in the
infection
hospital
gets
if people
high.
make serpentine queues.
So it's better you stay for 1 week at home. The weakness, fever subsides in 7 days or 1 week time, and the weakness may stays for another week. But only in very few cases in elderly patients or those who are having chronic illness, it may take a bit longer, the weakness part. But there is nothing to worry. It's a post-viral asthenia, which body recovers automatically with good diet, rest and nutrition.
Which I think goes for so many other viral infections. Okay, now Dr. Mishra, what are the government's guidelines to this? Is there anything that has come up and anything that you would want to tell the people?
No, I think these are whatever we have discussed are the guidelines. Basically that if any flu-like symptoms, take care of yourself well. Quarantine, self-quarantine is the best method to do at home instead of going in anywhere, and take enough rest. And in case somebody is at high risk and you are developing symptoms and you recognize the symptom, within 48 hours of that you can take that medication of antiviral medication, which can reduce the severity of the disease. It is possible, and that can be done as part of treatment. And those who are at high risk also, as we discussed, can get vaccinated. So whatever protection it has to give, that is the best protection you can expect, and that vaccination may give that protection. So I think people can consider healthcare workers, particularly the domestic caregivers also sometimes, or school caregivers also can have the vaccination. So if those people who can afford, they can have vaccination, because that can give protection. As we say, pneumococcal vaccine at early age group is given. A shot of that vaccine can prevent pneumococcal infection. Similarly, vaccination for flu is available and that can be taken. But panic should not be there. And most patients would recover without any consequence with only paracetamol, nutrition, hydration, rest and self-quarantine.
That's right. I think that is the crux.
To understand
so final message, Dr. Raheja.
Oseltamivir is only given for category B and C. That is the person with persistent fever, those who are at high risk like pregnant women, elderly patients, small children less than 5 years, patient with chronic diseases like asthma, COPD, cardiac diseases, diabetics, and those on steroids, or transplant patients, or category C patients, those who have got breathlessness, blood in the sputum, bluing of these nails, and children, those who are very lethargic, not eating well. So this group needs oseltamivir. For adults, there are capsules, 75 milligram twice a day for 5 days, to be started the first 2 days preferably. For children, there is a syrup. So I will say the take-home message should be: swine flu, nothing to worry. Human influenza H1N1, nothing to worry. Take precaution, have good diet, good nutrition, sleep well, eat well, and keep smiling. Maintain good hygiene. Have cough etiquettes, and if you have got fever or cough and cold, don't worry. Go to your nearest medical center, doctor, and take the proper medication. That's the key to success.
Right. Sir, what would you like to say at the end?
I would just like to make one amendment to what Dr. Raheja said, that it's not for all children under 5 that you need oseltamivir. If they only have a pre-existing comorbid condition which makes it severe, then only they need it, because common cold is so common in children below 5, then people should not panic that they need drug. So though everyone doesn't need it, that's an important thing to say. I would say that we need to remember one thing. If you look at the Western world, which has less of most infections, their infections were not controlled when new antibiotics or antiviral or immunization came. They came when their standard of living improved, and standard of living is not merely by money. We have situations in our country, people have money, they are educated, but you still see them throwing things on the road, spitting all over.
Correct.
It is this cultural change which is needed, and this will help us not only to fight swine and flu, 100 of other diseases which are equally dangerous and which can kill. So let us not just follow what is the flavor of the day. It was dengue a little while ago, and today it is flu. It is the good health which should be our requirement. And if that is our requirement, then we have to have good habits.
So basically, as Dr.
Very well said. Yes, sir. Very quickly, sir. Dr. Mishra.
No, I think we have said everything.
Yes.
So self-discipline, self-quarantine, basic hygiene, hand hygiene, basic sneezing when you are. Otherwise, also we say you put hand on your mouth, but it's the best thing to do.
This is the best thing to do. That's right. Well, so on that note, I'd like to say thank you to three of you for coming today and for breaking so many myths and for clearing so many doubts that people must be having about swine flu. So, well, folks, we've learned quite a lot, but if there's anything that you would want to know more and any feedback that you have for us, whether it is positive or not, please feel free to write to me on this address.
FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com. And our toll-free number is 1800115314.
And finally, I would just like to say that every flu-like condition does not mean that it's going to be swine flu. And as all the three doctors here said and told us again and again about the symptoms, which could be identical to many others, but if there are things which, as they said, the nails are turning blue, or you are coughing, your blood in your sputum, or you're feeling too lethargic and not really wanting to do anything, then that's the time to go to the doctor. But that again does not mean that anybody with any of the other symptoms just goes and makes a line in a hospital to get tested, because that's not what is really required. So maintain your hygiene standards, as that's very important. Maintain your coughing standards, and when you are sneezing, as the doctor said, instead of using your hands, use your elbow or your arm, and that should set it. And if everything is clean besides you, and if you're not panicking in any other situation, then I think swine flu is also something that can be taken care of. And yes, there are medications, there are hospitals who will treat you properly, but all this will have to be only under the guidance of a qualified doctor. So do keep that in mind. So thank you so much for watching. Catch us next week when we'll be talking about something else, that is some other health condition. Till then, this is Lottie Alaric saying goodbye, and please follow all the guidelines that we've talked about here to keep away from swine flu.